Kia ora Women's Health Action whānau, I'm Isis Mackay, Women's Health Action's Maternal and Child Health Manager. I'm really pleased to present to you the first of our new Digi-Updates. These updates, I've just got having a BBC moment here, and I've got my little kid in the background coming up snatching some blue tack. So these updates have been designed to give you a simple and informative overview of the latest women's and children's health policy, research and news, along with anything else that we think you might be interested in. And today I'm going to kōrero with you about the 2016-17 New Zealand Health Survey results published by the Ministry of Health last week. So the Health Survey collects information on the health and well-being of New Zealanders, which helps the Ministry of Health identify key issues and monitor trends. It provides information on health behaviours, risk factors, health status, long-term conditions and access to the use of health services for both adults and children. And the results have been displayed using a new interactive tool called the Annual Data Explorer. And it's a pretty cool use of innovative technology. And it's just a word of caution here that you really do need access to fast, reliable internet to be able to enjoy the experience rather than finding it incredibly frustrating. So also, if you prefer your data in a published report or something that you can print out, at the moment you are out of luck, although we are trying to follow this up. So the following 16 health topics were covered. That includes self-rated health, tobacco use, alcohol, illicit drug use, nutrition, physical activity, body size, cardiac health, mental health, primary healthcare use, emergency department use, barriers to accessing healthcare, patient experience, oral health, private health insurance and other health conditions. So rather than providing a comprehensive overview today, I've really just picked a couple of things that I think are particularly interesting to give you a bit of a taster of what kind of information you might find in the survey results. So of those invited to participate in the survey in 2016-17, 80% of adults, 13,598, and 80% of parents or primary caregivers, representing 4,668 children, agreed to be interviewed. They found that there was no difference in the percentage of men and women who reported that they were in good health. So that's the self-rated health there. And 8% of respondents reported experiencing psychological distress in the 4 weeks before taking part in the 2016-17 survey. And no surprises that women were more likely to have experienced psychological distress than men. The section that I found most interesting was the barriers to accessing healthcare. So they reported that women were 9% more likely to have visited a GP in the past 12 months than men. And the survey asked adults if they had experienced any of the following 5 barriers to accessing primary healthcare services in the past 12 months. And these included unmet need for a GP due to cost, unmet need for after-hours medical centre care due to cost, unmet need for a GP due to lack of transport, unmet need for an after-hours medical centre due to lack of transport, and the inability to get an appointment at their usual medical centre within 24 hours. So 33% of women reported having unmet needs for primary health care, which is 10% higher than men. 21% of women reported being unable to get an appointment within 24 hours versus 15% of men, and women were also more likely than men not to visit a GP due to cost. So I think that's just a real snippet of things to ponder here, and what's really clear across the board is that issues of inequality and inequity continue to burden the population of Aotearoa, New Zealand. So we've got a bit of work to do there, clearly. To check out the survey yourself, just Google the New Zealand Health Survey 2016-17, and just remember, patience is a virtue. Ka kite anō, and bye for now, and hope you enjoy your festive season. Thank you for watching.